So my name is Magda Rau. I am running a day clinic in South Germany. The name of the town is Kam. We are performing there cataract surgery, glaucoma surgery, but as well the refractive surgery as excimer laser and clear lens exchange and oculoplasty and EVOMS. I am as well running a refractive center in Prague in Czech Republic. I studied medicine in Czech Republic. Then I immigrated to Germany. I was in that time already ophthalmologist, but I done the examination again in Germany. So I'm specialized in Czech Republic and in Germany as well. And then I opened my own practice and my clinic, my own clinic in Germany. Not to lose the connection to Prague, I opened a refractive center, a small one in Prague. I was and I am still interested on new innovation. I was part of clinical studies, of European clinical studies. I was part of a clinical study of MSD concerning medication of glaucoma. Then I was involved in a multi-center clinical study of the refocus. It was the surgical treatment of presbyopia and as well glaucoma. And I was involved, I was part of the clinical study of the European clinical study of CyPass. I was some kind of pioneer of implantation of CyPass. I published and presented about CyPass. And I was as well one of the first who involved the multifocal lenses, so different kinds of multifocal lenses. And I still include new multifocal lenses in my clinic. I developed my own technique. It is a modification of LASIK viscodissection. Back to the multifocal lenses. On the beginning, when the multifocal lenses were introduced, it was array multifocal lenses of company AMO in that time. And then other multifocal lens was included from IOLAB. It was MF4. The optical quality of the design were not so good, so it was necessary to combine the lenses. In that time, I mentioned a difference in acceptance of multifocal lenses between men and women, because the women are shorter, had shorter arms. I like to hold the reading material closer. But now I presented a new topic. If the gender aspect is still necessary after the lenses, the multifocal lenses have better technology, but the answer is yes, because taking account of the gender aspect in the choosing and implantation of multifocal lenses makes the satisfaction of the patients higher. Yes, it is still problem. I was presenting in SOE, OSN meeting, and I was in the session. I was the only one woman. I think it is still a gap between women and men ophthalmologists which will maybe filled in the future, because the most of the women like to have a family, have a children, and it is then very difficult to take part on clinical study, to visit the congresses. Maybe COVID make possible to involve more women through the virtual meetings, through the virtual congresses as ever. And my mentor was Professor Magda Rau. She was the pioneer of excimer laser surgery. He performed the first hyperopia ablation in the world. He was as well awarded in US, and he was a very gentle and precise surgeon, so I learned a lot of him. My second teacher in surgery was a colleague from Israel. His name was Oded Ben-Chaim. I think the key is the honest interest in no innovation. The key is to seek more comfort, less invasive method for the patients. And then if you are access to this new technology, then you present it on the international congresses, and so it awake an interest on your research, on your person. I was always interested in sport. I was playing a tournament in Czech Republic. Now I am my own horse, Western horse, and I am regularly riding. And my other interest is in art. I am painting myself to relax, because our profession is very demanding, so you need some field, some hobby to relax, and it is for me painting. Everything we do until now is some kind of compromise in presbyopic eyes. The presby ablation, even the implantation of the multifocal lens, because a very few part of patient is now able to deal with the focus and so on. So my wish would be the rejuvenation of the eye. I am now a consultant of the company EyeSee. We are developing scleral laser for treatment of presbyopia and as well rejuvenation of the eye. We try to go the way it would be my wish for the patients.